Hello everyone. So today I'll be talking about 10 early signs of diabetes that you should watch out for before it causes damage. If you see these signs, you go to the hospital to get yourself checked if you have diabetes or not. One of the signs is frequent urination. Now, frequent urination occurs because now there's high amount of sugar in the blood. I know it is the kidney that filters the sugar that in the blood, that filters whatever is in the blood. So there's certain amount of sugar that the kidney can reabsorb back into the system. But because there's high amount of sugar in the blood, the kidney absorb the one it can absorb and then excrete the rest with urine. Now, as the sugar is being excreted in the urine, it draws a lot of water also with it into the urinary tract. So the patient passes a large amount of urine and then frequent urination also. Frequent drinking of water. So the person that is having diabetes get thirsty frequently. So you drink a lot of water. Why? Because it's also passing a lot of water in the urine. It is also normal for the person to drink a lot of water. Urinary tract infection and then yeast infection also in women. Now, because the diabetes damages the nerves and helps you to know that your bladder is distended. There is enough urine in your bladder. It's now time for you to go empty your bladder. So the nerves are destroyed. So you might not even know when your bladder is distended. And because the urine stays there for a longer time, it can bacteria grows there and then lead to urinary tract infection also. And secondly, the urine contains high amount of sugar, which helps the multiplication of this bacteria and can cause urinary tract infection. And this sugar helps the yeast to multiply also, so the woman contact yeast infection easily. So if you know you are frequently treating yeast infection as a woman, it is good for you to go and check your sugar level. Another point is weight loss. Now, you know the main problem in diabetic patients is there is sugar in the blood, but the sugar is unable to go into the cell for it to generate energy for the person to use. So because the sugar is not able to go into the cell, the body finds other way by breaking down stored fat and then even breaking down the muscle also to provide energy for the person to use. So this breaking down of stored fat and then the muscle also makes the person to lose weight. And that point can happen again is because of dehydration. And as I said earlier, the person that is having diabetes urinates frequently, and then this leads to dehydration. So that can also make the person to lose weight. Blurry vision. Diabetes also causes blurry vision. Damage on the blood vessels that in the retina that cause blurry vision. And again, in a diabetic patient, because of the high content of sugar, some fluid moves into the lens of the eyes. Now, when it moves into the lens of the eyes, the lens swells up, and then the shape of the lenses changes, and then this can lead to distortion in the focus of the individual with diabetes. So this can also lead to blurry vision in a diabetic patient. Getting tired often. And a diabetic patient gets tired often because, as I said earlier, the sugar is unable to get into the cell for it to be used for energy, and the person is also losing water through urination. So the person will feel weak, often even without doing anything. So if you met this and have been saying so far, please go to the hospital to check your sugar level. Now, diabetes can also lead to skin changes. So that is damage, I say damage small vessels that can lead to spots, dark spot on your body. It can also lead to a condition called acanthosis nigricans in an individual. So if you notice that you're having spots on your body or your skin is getting dark, please go to the hospital and check your sugar level. Numbness or tingling sensation on your feet. Uh, this one means the nerves on your feet are getting damaged. So it's part of the one of the early complications that can lead to diabetic foot. So if you notice that you're having tingling sensation or numbness on your feet, please run to the hospital for proper medical checkup. And erectile dysfunction in men, because erection has to do with blood, it has to do with blood vessels. So diabetes can compromise your blood vessels and then you have difficulty having erection and sex drive also. This can also cause change in period. So if you notice that your period is not coming as usual or you're having delayed period, you can also go to the website to check to find out if your sugar level is normal. So prevention of diabetes and its complications is everybody's goal. Please, it's better for you to go to the hospital. They tell you, okay, there's nothing wrong with your sugar level, than staying at home and then finding out late when the complication has already set in. So please, when you identify diabetes on time, it can be well managed. Thank you. I remind your doctor, Dr. Enoja. So please subscribe to my channel and click on the notification button.